Afternoon. I guess this is better before lunch. Otherwise, your brains will get lesser blood supply, right? So we'll start with the setup, right, from the zero. And he is Mr. Pratap, who is our clinical expert. He will take you step by step on the settings and putting up the circuit with this machine. We'll be happy if you guys come up for each step, do it. Try to do it, don't get afraid, right? I'm also not very much expert with this machine, rather I'm with other machines, but I'm trying to get them, right? So Pratapji, let's start.
Welcome you all to this session. Behalf of President's Medical Care. Hello. Yeah, we are here to introduce our new CRRT machine, behalf of President's Medical Care. We are here to launch or we can introduce a new CRRT machine, which is a multi-filtered pro. Multi-modality team player, what we call it as. Because since this machine, you must be having that previous model that is multi-filtrate classic machine. This was just some added features like Sika scale, and a lot of things have been already modified, and it is more user-friendly. We have robust scales which has got the capacity of maximum 20 liters, 10 liters for substitute, 10 liter for the dialysate also. Even for the filtrate, that we can add 10 plus 10, 20 liters like that. Overall, the nursing intervention will be on the lesser side. I mean, it will go for a longer treatment. 10 liters. So we have, we can connect a Y connector. So 10 plus 10 we can have. Two bags can be connected. Yeah. Even our multi-filtered classic also, that provision is there. Yeah. So this is a machine. I just would like to just give a small overview on this machine. Yeah, just switch on the machine. This is the display. We have 15-inch TFT display, the touch screen. Okay, this is the new addition to our multi-filtered classic machine. And altogether we have 1, 2, 3, 4. Dr. Aashish sir already explained you given the presentation on that. Blood flow, blood pump, filtrate pump. Okay, then the dialysate and the substitute. Okay, and these 4 pumps, apart from that, there will be 2 pumps of the Sika therapy, citrate and citrate RCA. That is, this for the citrate and this for the calcium infusion. Yeah. Then we have that pressure dome system is there. This is a pre-filter pressure. This is the access pressure, what we call it as the arterial pressure. Okay. Returning pressure, that is the venous, and this is the filtrate pressure, that is the negative pressure, ultrafiltration. Okay. So these are the calcium infusion systems is there. 2 scales, dialysate scale, substitute, and this is the filtrate. 3 and 4 is meant for the overall, whatever effluent come, it will get collected in this bag. So now I will start with the machine. This is the on-off switch for the machine, okay, and this is the manual on-off for the pump. And machine has got the assisted priming, what we call it. Just you have to select the therapy. First, ideally, what we do, like CRRT machine, it's basically a portable machine, which can, wherever we can just plug in, okay? And we have the extracorporeal circuit and the bags, fluid bags. So just pass the test. It's self-test. Hardly it will take 1 or 2, maximum 2 minutes it will take, consume. Less than that, less than that. No, this is maximum. It's 2 minutes only, sir. Yeah. So, okay, and once the test pass, keep the things ready, and you are assisted. It machine will, in Multi-Filtered Pro, they made it like a graphical. I will show you that. So, how to connect it and like that, like 5008 philosophy has been continued. So, okay. So, machine is on. First, you have to go for the functional test. Okay, so just start functional test. So here is the status bar. Yeah, here you can see functional test in progress. Okay, and we have the treatment modalities, multimodality, what I call. But right now, today we'll be going for a continuous veno-venous hemodiafiltration, pre or post. Okay, so let the test get passed, then I will select the modality, then machine will assist me and it will guide me how to make the connection. So that is, this is mainly for this newcomers, as we know that the ICU nurses and all, they are not very much familiar or well versed with the CRRT machine. So the machine will definitely help them out to make the connections, and then auto priming will be there. Just give the message that connected, and that is also to just go arrow. It is more, what I mean to say, it is more, it made very much easier for the operator to perform the preparation work. And then machine will ask you to connect it to the patient like that. So almost. Yes.
Could I just ask a question? So in the audience, do you normally set up the machines? Do you do it? Yeah, you do. So who is familiar with setting up machines? One person, is that correct? And the rest, so where I work, we as doctors, we don't set up machines. So it's done by the nurses. And I've been to these courses where I then learned how to set up a machine. But is it correct, the majority here has no experience in setting up machines? So when you then suddenly do it in a course like this, it actually turns out it's much easier than I had ever feared.
It's very easy. But most nurses and technicians in India don't speak English and they're not fluent in English. So the screen is really not that helpful to them. My nurses, for instance, are most familiar with Marathi. So the screen has absolutely no meaning to them. We have to tell them step by step how to set it up. And I think that's probably the case in many hospitals. Nurses and technicians are familiar with their local language and Hindi at the most. A few of them would understand English instructions.
I would tend to disagree because you see, CRRT in our country at least, where cost is a huge constraint, is almost synonymous with the upper segment hospitals. And the kind of staff who are employed by these hospitals, definitely language universally is not that big a barrier. I mean, if you were to generalize, if you were to say that, okay, a plain hemodialysis machine has only English written, I would tend to agree with that. But then when it comes to CKRT as a top-end treatment, majority of the staff would be familiar with English language. Yeah.
Are you familiar with the bits which you can see here? So you're familiar with the pumps and the alarms? Okay. Unless we can just say where the flow. If you just say what the different pumps are once more again, and then the people not everybody.
So this is actually black pump. So this will be effluent pump or filtrate pump we used to say. So this is blood pump. This is filtrate pump or effluent pump we can say. This is dialysate. This is for substitute or replacement fluid. And this is for citrate and this is for calcium. So 6 pumps plus additionally heparin pump is there in the side. So for no, in case heparin, if you wanted to start, we can start with the heparin. So also there is a pressure domes, because earlier there was a air interfaces, pressure domes were there. Now there is no air interfaces. So we have so it's a air free monitoring system like pre-filter, arterial pressure. This is for filtrate pressure, and only one transducer will be there, that is for venous. So this is venous chamber holder. Here will be blood detector plus air detector will be there, and there is a line clamps. One is return line and one is for access line. So this is for blood leak detector. So if in effluent, in case any blood is coming out, so we can detect and it will give alarm. And also, as sir told that, yes, English, no, but in this there is a diagram as well. So they can easily understand how to connect. So it's very easy to understand because the diagram is there. So they can step by step they can go by.
So as per Dr. Lobo, I guess it happens sometimes I have my centers in Punjab where they don't know English, they know Punjabi. But sir, if you have anything like this, let us know. We will train the technicians.
That's what we do.
We
We rely then on training so much so that they do it by sort of by practice without even looking at.
We have created now booklets also for this thing so that by diagrams they can understand. We are also coming up with the VR-based technology where the technician can train, learn this. Once they know this, then they won't have a problem.
Yes, and also as what they just said, the terminology, the Prismaflex calls it effluent, you call it filtrate. So when somebody switches between machines, they need to realize what the machine is saying. And this is calling it filtrate, that calls it effluent.
So that's corporate war.
Stick with one machine. You call it substitute. You call it replace. They also call it replace. You call it substitute. Baxter calls it replace.
So terminology difference. So now I'll proceed for the demonstration. Okay. So these are the you have to keep everything. This is used by.
Hello.
So this is the cassette, multi-filtered pro cassette is there previously. So it is all the circuit like blood pump segment, filtrate pump segment, substitute and dialysate. And even we have a different kits for heparin therapy. This is the heparin therapy I am going to perform. And for the Sika, extra that calcium and calcium and citrate pump segment will be there incorporated in the cassette. Yeah. So I will select CVVH.
Again, filter is not attached like this. Filter is different, so we can change it in terms of filter coating. There is a coefficient to change.
Yeah, yeah.
So that's the benefit theme with the classic as well. So when you're, unfortunately, if your filter is clogged, you don't need to change the whole circuit. You can just change the filter, so that not only saves your time, but also saves the cost.
Okay. So now I'll go for CVVH DF pre or post. Okay. Then machine are the start requirements fulfilled. That means I kept everything ready, right from the filter, bags, substitution fluid and all like that. Okay. Then I will say okay. Chalo. So this is what the assisted priming. Yeah. Graphical as well as instructions also, followed by the instructions like that. So I'll just go to hang the solution back. Saline.
So let's start with one of you. Why not you climb up and do the starting one?
If somebody can know. Yeah. Good.
Have you done this before? You have?
Not on this machine, I guess.
All right.
Yeah.
Okay.
Please. Saline. First you just follow the instructions one by one. I'll read. Hang saline back with IV set. Yeah. Yeah. That is. Okay. Because yeah, it's there. Okay. Then IV set. ये निकाल के देना.
So just in the meantime, I'll ask a question. I mean, I might not get the right, but I'm standing here, so I get the right on this type of table. Suppose if you want to do CVVHD or you want to do CVVH, which therapy are you going to select in the machine on the first hand? Specifically for new nephrologists and young people. Yeah, so what if I select CVVHD? Exactly. So this is the first thing, you always select CVVHD if either you want to do CVVHD or H. Because if you want to come down from CVVHDF to CVVHD, you just need to make the replacement or the substitution 0. Or if you want to do CVVH, you need to make the dialysate 0, right? But you cannot go up. So you will have to again return the blood, stop it, again put it. Right? So always choose CVVHDF, whatever you want to do.
Only filter will be separate.
Now earlier one you had separate lines.
Only filter was separate.
So with classic, it was only the blood lines type thing. This is now a cassette.
And there are so color code is there already. Arterial blood pump segment, filtrate, dialysate, green color, okay, and this is a substitute. So you have to just make it like this.
I guess one more person can join if anybody wants. Sir, I.
There are two pins are there, this one and this one. First you mount. पिन में पहला रखना ये पिन हाँ ये
These tubings have a little sensor behind it. So there is a little spike on it and there's a sensor there. When they put it in there, this dome and it engages, this will come out. One by one.
like 5,000.
Yeah. Just push it in. Yeah. This in. And this will come out. So now push that in.
Now top tone will be like okay. The artery.
Same thing will happen. See the spike? See, there's a spike here and there's a sensor here. So when you place this and as he did, he pushed it, the sensor will engage. And this came out.
And this will come out. See, pressure dome will come out. Okay, there you have to place this right. Yeah. Okay, then place in the line clamp. Go to the similarly, one part.
You may just have to speak a bit louder because you just tell people.
Yeah, bubble catcher, and this is an air detector, optical sensor. Optical sensor, air detector. This is occlusion clamp, venous occlusion clamp, return line. Okay, this is a arterial occlusion clamp. Yeah. Okay, blood pump segment, filtrate pump, access pressure, there is arterial pressure, pre-filter pressure, and this is filtered pressure. Okay, venous.
Where does your replacement fluid enter the circuit?
I'll connect this. Venous pressure. So 4 pressure transducers are there. Okay, pre-filter, arterial, filtrate, and venous. Close the door. Oh, now. Yeah, push, you can push. Yeah, that sounding should become, okay, and now this one also, open, yeah, same like. Okay. Know how to open the multi-bit dial. Okay, good, yeah, that's all. Now, we have a fluid warmer system, okay, for the dialysate heating and for the replacement. So this is the green one that I, okay. This is dialysate.
It's connecting the line to the dialysis.
Yeah. So, yeah.
Anybody next to him? मैडम हिंदुस्तान है, उसमें अपने आप रुमाल रखना पड़ता है. आइए.
Sorry.
आइए. करवाइए.
turn the machine, let them see that.
Okay.
Battery.
Okay. So these are, heater chamber. Okay, this is the bag. Yeah, you have to fix it like this. This is for the dialysate heater bag, and another for the substitute.
You can stress that this is your advantage over Baxter.
Yeah.
Because they
नहीं,
found the blood return.
वो बाहर आना चाहिए. Green जो है ना.
This you have to stuck here.
और
So he is warming the dialysate and the substitute.
so they have made certain changes, like previously that Y, now they made it Y connection like that, okay? One is substitute and one is dialysate. So for the heater bags, yeah. Then right. Just remove. Then white should come. I'll show. Pull it.
Right.
Okay.
Pressure monitoring, and it will goes to the pre-filter pressure. So, let me explain. This is from the patient, and it is coming to the arterial line clamp. Then it is arterial pressure monitoring. Then it will be a pre-filter pressure monitoring. Then it is going to the pump.
So
Then
who wants to open the multiple? You need to know.
So this pressure dome is just before the pump. So
One
it will always have a negative pressure from this. The access pressure will be right here and it will be negative. This is immediately after the pump.
After the
so
pump.
it's the most positive pressure. The highest positive pressure will be here.
then it will come into the filter. Okay. From filter again, it's a venous line. It is going to the chamber. This is a air bubble chamber and venous bubble catcher, we can say. So air detector plus blood detector will be here. Then it will be a line clamp for venous line. If any alarm comes, it will clamp automatically. So then it is going back. This is going to the patient. So this line will go to the patient. So now for priming purpose, already the presetted bags are there. So milliliter we can do.
So this is the line which I just told you. So it's a Y-shaped connection. Y2 each. Y2 each.
So
I told you that we can keep 20 liters there, right? So that reduces the nursing job. So just to reduce the error, if you have two potassium variant here, you will have two potassium variant here. Right? Unless you want to mix and do the maths. You can do that. Nephrology is the science of making fluids, but you should know that. So it is to reduce the error, right? You will connect both fluids separately and then combine.
pardon sir?
Except sir opened the bag and
144 ml for
no.
adults.
As I said, not necessary every time your
Including
technician who knows how to do CRRT is on duty. And if you
Take
don't
some
do it,
strength to break that seal.
you can check it. This is multi-pick. So now now how do you understand? It's a potassium 4K variant, right? So this is also for the nephrology because you will write in the prescription which potassium ion to be used, right? So you need to know potassium ion. Keep it ready. So they both are 4 potassium variants.
This is the effluent line.
Effluent line.
So in this, everything will come. Your set ultrafiltration, your replacement fluid, and
Plus
your
I-
all will come through this. Then the pressure is right here. It goes, the pump is pulling, and it will go.
Hey, baat, hey, baat.
So this is a blood leak sensor. So we inserted in
And here you will get your pen.
effluent bag will be connected.
Yellow here, yeah. So it will come to the yellow line. Yellow line, yellow door, and yellow flag.
So, back changing, that is really a tedious job because we have the 5 liter bag, heavy bag, and especially the nurses, they are just lifting and that. So, just every time they have to go back and previously they have to load the bag. Now, there is a provision that we can simply, yeah, I can do it from the front. Just leave it, connect it and just leave it. Is that a new solution?
Are your lines color coded? No. But they are
Yeah. Lines are colored. Okay. So, that Y connector, I showed you already.
Can you just clarify? You cannot connect the circuit to the wrong pump, is that right?
Tell them.
Because that's what I was told.
So what-
Even if you can't, even if you're a novice, you cannot connect the wrong bit to the wrong.
Exactly. Because the both fluids are same.
No, that's not the line.
No, I agree. So, one thing is like, what she wants to say that you need to understand which bag you are connecting. The dialysis or the
Other question, when you connect this here,
Answer is, when you place this here and you open this,
Yeah.
it will automatically set this way. Now this pump has got a red line across it, and this red sensor will go, this red cam will go here. This one is all yellow, and the yellow one is red.
but you cannot put the yellow, I mean, doesn't read
No,
the yellow.
the sensor will not read.
Yeah, that's right.
It will not read. This will not open. Because once you turn it over, line is becoming if you turn it here.
That's what I was told before, that
So you can't accidentally connect it.
Now, if you open it, food is not coming. So you need to break this. One only break. Corn is here, no? Corn you cannot break. Just break them. Then only food is good. कोई इसमें ये food करना चाह रहा है तो ये इसमें बात करते हैं. Okay, then do that. हम अभी नहीं लगा रहा.
Your bubble catcher in the Baxter one, where the replacement fluid port is delivered from the top and the blood enters in from below. So you automatically get a layer of replacement fluid over the blood in the Baxter. So here I don't think
yeah, because this is the one
car band.
so theirs is also transducer, but the air is above the replacement fluid and not above the blood. It's in contact with the
but the bubble catcher overall the priming is designed in such a way that it will take care of the level level
That's not it. You have an air blood interface which can clot, which they don't have.
So this is all connected. Okay. Next. This becomes tension is not there, right? Yeah. So now they ask for the actually thicker and separate, and so it is not there. So these are the graphical representations. Okay. These are the connections. Right? Read it. One more read.
Place positioner in dialysate and substitute pumps until an audible signal is given.
Place this.
Then close the pump door.
Yeah.
Connect substitute lines and post dilation port above the bubble catcher sensor.
Substitution. So we connect.
Connection line needs to be connected here.
Yes. So this is 4. Clear indication. And 3. Yeah. 3. Yeah. 4. Primary.
If you are open, in case cap is missing, there will not come out.
Yeah. So clamp is open. Next.
Heater back with marking white downwards into the heater.
Okay. Download into the yeah. Yeah. Correct.
And insert marking white into holder.
Yeah. This is the holder. Okay. Yeah. Next.
Heater back with marking green
Yeah.
downwards into the heater and insert marking green into the holder.
Okay.
And connect dialysate and substitute line into relevant solution. Each seat.
Yeah. So connected. Both the
Already
solutions
been
connected. Back side.
Pratap, let them come up and see.
Yeah, please. So this is scale 1, that is a dialysis. Scale 2 is for hospital.
You can add 2 more bags if you want. If you want. Not necessary. If you want, you can connect 2 more bags.
Can I open this to see how it looks, or
Fluid
will
will
it
come.
be
Fluid will
clamped
come.
now?
Because
Clamp, so
already
it will be
connected. So
okay.
why connected? No.
Right, right.
So from here, fluid will come.
Clamp, so it won't come.
This is injection port. This is for if any competitor machine if you wanted to use. In case, suppose if you wanted to use this fluid into this, you can use. So you, see, if you connect this simply, fluid will not come out. You need to break this cone. Inside cone is there. We already got it. Here also is there. White color cone is there. When it is broken only, fluid will come. The competition, any competitor machine, if you wanted to connect this fluid back, you can connect. So this is dialysate, this is yeah, composition is this. Suppose Baxter machine if you want to connect. Injection. Common from here. Common tube. Yeah, common tube. Taking out here. Because it is simple salt. Again, ultimately you don't get your food. Here what is happening? Either they will listen them anyway at this input I think no error can be, yeah, no error can be. will run. 10 liters for dialysate, 10 liters for filtration. Yeah, that even if you want different, suppose 4 potassium here and 2 potassium here, so 0, then it will mix and come. So at least 3 potassium you will get it. So that is the way. And technicians, even by mistake they did mistakes also. This will erase that error. We can come 2 bags. Yes, 2 bags. 2 bags at a time we can come.
Don't why there. Don't why but there. One why yellow go.
This is put on. You see, right now we connected, we should open, others are closed. Otherwise it will leak. Now already I broken, so fluid will come out. Then you just, it's a lever lock. Just screw it, that's all.
Can you tell again? We could not see.
There is 2 bags. There are 4 connections. If you want, it is not necessary. If you want, take your time, you can connect 2 bags here.
Or
One also is okay.
clamp.
Yeah. And if you are connecting one, another clamp needs to be connected. Another here also you can connect 2 bags at a time. So laser's intervention will be less. Otherwise, every 5 hours, whatever flow settings you are doing it, accordingly they need to keep on changing the bag. So 20 liters if you keep, at least the time which they are interviewing, that will come down.
And one will be dilated, two will be
Two will be replacement. And this is
substitute. You are saying.
okay, so now I attach and once you attach also fluid will not come out. There is a cone. Now that you need to break it like this. And this is for any competition machine if you suppose if you are using, you want to do that. This control you can do. This is for only power machines. This is for suppose Baxter machine you are using. You wanted to do this.
Okay.
Okay. This is only with our machine. Because of that, this is an induction. If any induction need to be done.
There are at least 10 or 12 CRRT multi-bit zeros 1, 2, 3 and 4, 5 right? Along with them there are calcium, low calcium, medium calcium, high calcium. Then there are phosphate base. आपके एक ही कमरे में अगर 25 फ्लूइड रखे हैं, your technician might get confused. And if you place avoid error. So and second point, suppose we connected wrong line by mistake, that will not alter your. It will mix basically. This is mainly potassium mix, but it remains the same. ठीक है? Both zero रहेगा तब जाएगा. Zero एक हो रहेगा तो as an apology. आप suppose अपने patient को 2 protection देना चाहते हैं, right? आपने डायलिसिस 0 अलग किया, इसको 4 अलग किया, right? तो 0 से निकलता रहेगा, 4 से आता रहेगा. 0 रखने से आपकी दोनों zero रखने को यूज है. I don't use 0 ever. Right? Most of the time I use 2 and dialysis 4 and diffusion is always stronger for electrolyte. So diffusion उसको बढ़ने नहीं देगा, replacement कम नहीं होगा. You can use it, but then 2 and 4 becomes what?
So your patient is not getting hypertension.
So altogether 300 ml it will consume for the 500 ml. And then it will ask for the UO3. Then additional. So that is what you do now. Substitute function. So that line. First the blood line.